What's up, guys? It's Coach Gaglione here. This is another edition of the Powerlifting for People podcast. I'm your host. We got Eric from LifeMed on the line. How you doing today?
John, happy to be here, bro. Thanks for having me.
Excellent. So, yeah, we're kind of continuing our conversation. We had another podcast. There's another kind of studio up north at our New York location. So I'm in beautiful Rehoboth Beach. LifeMed Institute in Rehoboth Beach is actually kind of right across the street from where we're living right now, which is super convenient. I've gotten a lot of therapies there. I've gotten some IV treatments. I've gotten some work done on my shoulder, some blood work done there. And they're kind of like our office of choice down here. So if anyone's kind of local to the area, but I'll kind of let, Eric kind of talk a little bit about like what LifeMed is, what services offer. And then today we want to really kind of focus on continuing that conversation on, just kind of the longevity and the health of a lifter in mind, and kind of like what that kind of mean, what you should look out for, what you should kind of pay attention to. So I'll let you kind of give a quick intro, and then we can kind of discuss some of the services offered and maybe some things that lifters should consider when it comes to their health and their performance.
Yeah, that sounds great, John. Yes, I mean, the first thing is LifeMed. We're a wellness center. We're a concierge wellness center. So our thing is age management aesthetics, all the facial contouring, lip fillers, Botox, VI peels, diamond glows, cardiac preventative medicine, and the hormone replacement therapies, bioidentical hormone replacement therapies. We have a wide array of different things that we do. It's the blood panels. We talk a little bit offline about that. The blood panels are significant. We can talk a few minutes about those further on here, but that's probably my favorite part of the service we provide, because it's a very extensive overview of what's happening internally to give you an idea if there are deficiencies or imbalances. But then it gets into the IV therapies, the nutrient IV therapies. Everybody calls them the hangover bags, which you don't have to be hungover to do them. A lot of times I meet people out and like, oh, stop it and see if I'm wait till I'm hungover. I'm like, you don't have to wait till you're hungover. You come anytime you want to. Some of the injury stuff, the injury repair stuff you mentioned there too, John, is the PRP, the platelet-rich plasma, human cellular tissue products. We have the EPAT, extracorporeal pulse activation technology.
That was really helpful.
Yeah, EPAT's awesome. Love EPAT.
Little quick anecdote for that. I just want to because I don't mean to interrupt you, but I think it's a nice little anecdote. So, I kind of pride, it's kind of tough, being the coach, but also like still competing and things like that. Cause sometimes it's like, I do as I say, not as I do. Oftentimes we have the knowledge, but we're kind of sometimes our own worst enemy. But so anyways, rewind a little bit. So it's the end of June. Training's going really well. I'm like the strongest I've ever been at this body weight. I'm kind of everything. I'm on a tear, right? So I'm kind of coming down to Delaware. I get a workout in, not feeling so great. Something pops in the back of my shoulder, and it's like the one I dislocated. So anyways, kind of freaking out a little bit, whatever. This, not so, I'm just going to like kind of rehab it slow, whatever. So I got that treatment that you mentioned. And lo and behold, in powerlifting, there's something called like a Wilks and like a DOTS formula. And it takes into account the weight you lifted, and as well as your actual body weight. And one of the things I did to help rehab my shoulder was that therapy. And I was able to hit a personal best, kind of pound for pound, my best meet ever. It was my first, they have like an elite total, and then above elite is called a professional total. It was my first professional total since 2006. So it wasn't, I fell a little short of the numbers I wanted, but when I first injured my shoulder, I wasn't even sure if I was able to compete. And that was one of the things that like LifeMed helped kind of get me back on the platform. And that was really fortunate. I haven't had too many injuries powerlifting. That was one of actually my major ones. And I was really fortunate I was able to even compete. So just wanted to kind of share that story. It was a really cool thing. Sometimes we make mistakes too. I kind of overdid it a little bit, but I was able to kind of rehab myself back. And then September, I hit my best meet ever. So I just wanted to kind of share that story with you, because it was pretty cool. So a lot of people don't realize there's so many services. I got a lot of the IV stuff, and I really love just the vibe, the atmosphere. You got the massage chair and all that. It is a really nice concierge service, and it just feels good kind of being in there. So I can kind of attest to that.
Yeah, John, you brought up a couple good points there. Number one, like I was in the Marine Corps, right? So it says we have this improvise, adapt, and overcome mentality. If something's hurt, just push through it, keep going. So I think that's more probably of a male trait than a female trait. And you brought up another good point too, which I think is so critically important. And as guys, I just feel like overall, to make a blanket statement, I don't think guys are as good at this. And this is the internal workings of what's going on. As guys, I think we put so much emphasis on how far we can run, how much weight we can lift, how hard we can train. But what we don't pay a whole bunch of attention to, normally until it's too late, is everything internally. You look at cardiovascular disease, right? I've become obsessed with everything cardiovascular. And I'm not a medical person. I'm not an MD, MP, PA, LPN, RN, MA. I'm none of that. But I've become obsessed with cardiovascular health because the very vast majority of it is preventable. Yeah. And it's hands down the number one leading cause of death, men and women. Second place doesn't even come close to it. It's very preventable. That's what I love about our blood panels, because there's so many different markers that we check that gives you an opportunity to not just optimize what might be deficient in the forms of nutrients or anything else going on, but also to really pay attention to the lipids, the LDLs, the HDLs, triglycerides, apolipoprotein B, LP(a), hemoglobin A1C for prediabetes, PSA, prostate-specific antigen for guys that are 40 and over. These are all things that we don't really pay a whole bunch of attention to. And normally once it's brought to light via physical or an annual blood panel, once it's brought to light, it could be far advanced enough where it's a little difficult to make the reversals to it. So that part I'm really obsessed with is just what's happening internally, because as guys, we don't pay much attention to it.
Yeah, and I think you kind of, the thing I kind of want to bring back, you had like a laundry list of different kind of markers there, which I think is obviously, like, a lot of people are like, their heads might be spinning right now, but I think that's kind of one of the benefits of going to a place like LifeMed, because you can kind of get like blood work done at a lot of different places. I'm sure we've gotten blood drawn at your local doctor's office, but the panel is very extensive, like you kind of mentioned. So can you maybe explain about, like, when you get the blood drawn and then having, I know, like, they might be not familiar, actually having like someone kind of go through it with you, because I think that's really important too, is that you're not even just getting the results, but you're also kind of getting like kind of those results explained to you, and then you can kind of talk about, based on these results, then we can kind of discuss supplements, intervention, that sort of thing. Maybe explain how the process works a little bit.
Yeah, good point. And this is the thing where it comes like primary cares and all, John. It's like a lot of times they pull your blood, and as long as you're in range, they don't pay a whole bunch of attention to it. They don't really discuss it unless there's something that's outside of range, which for us, we're looking to optimize. So what we do is with the blood panel, it's 76 different markers. So it's hormones, genetics, cardiac particle sizes, metabolic, kidney, liver function, glucose levels, thyroid levels, inflammation markers, vitamins. It's every single marker you'd ever want. When you sit down with one of our providers, our medical director is a cardiologist. We have 10 nurse practitioners, 2 physician assistants, and 1 other MD that work underneath them. You spend an hour, 60 minutes with that provider going through not just the areas that are green and wonderful, but the areas that are red, the areas that are yellow. This is looking to optimize. The whole goal with the blood panel is to potentially find places where we can make you feel better. This is what's so critically important. It's finding the things you might not know is wrong. At the conclusion of the meeting, they're able to give you just a list of, okay, this is what we recommend. Everybody can benefit from a multivitamin. Everyone can benefit from an omega-3 for fish oil for heart health. Everyone can benefit from vitamin D, from methylated B12. But if you don't know, and if you're just trucking along, you don't really know how to optimize, especially athletes like your viewers, your listeners who are competing at this high level where your body's just getting beat down. You're working hard. You have to make certain you do optimize. And that's where our panel really does stand out.
And, since you kind of mentioned the athletes and maybe some of the people viewing. So a lot of people viewing, some people may be competitive, some people not, but I think a lot of people are looking to optimize their strength, maybe their lean body mass, their muscle mass. And obviously they want to try to have their joint health and kind of, in mind as well. So kind of based off those things, what are some markers or maybe some services that you think would be kind of a good fit for that type of lifter?
Yeah, one of the main things we would do a lot of, John, I'm not sure if you've heard of peptides. A lot of your viewers might have heard of peptides before. BPC 157 is probably one of the most popular peptides in relation to people that are in the high level, whether it be MMA fighters. We're partners with the NFL Alumni Association. We have active NFL players that come in for IVs. BPC 157, it's an anti-inflammatory. And your peptides are just branched chain amino acids. We refer to them as performance blends. So these are things, again, if there is some sort of inflammation, if there's joint pain, if there's whatever, could possibly be a tear. We talked about the PRP, the platelet-rich plasma, and the human cellular tissue products. But it could just be something that requires that type of peptide. Or you mentioned the EPAT, the extracorporeal pulse activation technology. This is shockwave. It's just non-invasive. It's non-surgical. It increases metabolism. And I got to tell you, of all the services we provide, we have lots of them. The EPAT for me, it's the easiest, least expensive, quickest turn time. It's just, I am in love with EPAT, especially for injuries that are not full-blown, like requiring surgery, but enough where it's that nag, it's that aching. EPAT works extremely well.
Yeah, and sometimes, you just I've been pretty fortunate. My worst injury back in 2011, I partially tore my rotator cuff, and every now and then it flared up, and that was actually the side that did flare up, but that therapy did really help. Um, but yeah, I mean, I think a lot of times, when you are performing at a high level, even if with good nutrition and good, sleep and all that stuff, sometimes when you're really pushing the envelope of performance, little tweaks happen. You might, maybe throw your back out, or you kind of tweak a muscle, whatever. I kind of had this, and I'm not gonna lie, I was pretty worried because I've been, pretty fortunate. I'm pretty knowledgeable with the programming, but things happen sometimes. So I think understanding like what options you have available. And in terms of like kind of the peptides, especially because I know there are some people that may be averse to maybe doing hormone therapy right away and stuff. So what would be what are kind of the different? I know you kind of mentioned it's kind of an amino acid family and all that. So for people that are kind of maybe unfamiliar with the difference between the hormone therapy and the peptides, what would you say is kind of like the main, difference between those two things?
Yeah, so the hormone replacement therapy. So when we refer to HRT, hormone replacement therapies, TRT, testosterone replacement therapies, obviously testosterone is our predominant hormone in men. When we talk about TRT, what we're talking about is, or HRT, they're all interchangeable.
Sure.
What we're talking about is replenishing what is now deficient. For guys, once we hit about the age of 30, our testosterone levels naturally begin to decline. There's nothing we can do to stop it. There's nothing that we can do to prevent it. It's part of our evolutionary makeup. As we age out in the wild hundreds of thousands of years ago, we didn't have to hunt as much. We didn't have to fight as much. We didn't have to reproduce. Those levels drop. With testosterone replacement therapies for guys, we're looking at levels that are diminishing. And then what we're doing is replenishing them, getting them back to physiologic levels. So it's important to point out, we're not replacing testosterone above levels that you've never had before. We're just replenishing what's now missing. And I think that's the big misconception, John, when a lot of the guys especially think of TRT or hormone replacement therapies, they're thinking about, doing something that's cheating or doing something that's illegal. This is hormone replacement therapies that are giving you back testosterone that, number one, helps with decreasing body fat, increasing muscle mass, more energy, sexual vitality stuff. That's wonderful. But equally, if not more important, are the long-term heart benefits to testosterone replacement therapies. There are significant benefits to replenishing testosterone, helping to prevent mainly what's called ASCVD, atherosclerosis, cardiovascular disease, which is really one of the only inevitable diseases of our species. Every single person will die with cardiovascular, maybe not because of it, but with it. As it relates to the guys, it's the testosterone. For the ladies, this is really where I become obsessed over the last couple of years. You probably have quite a few female listeners as well. Hormone replacement therapies for the ladies, getting into all that perimenopause, menopause, postmenopause, hot flashes, night sweats, brain fog, insomnia, hair thinning, weight gain, sexual vitality, vaginal atrophy, vaginal dryness, urinary tract infections, heart palpitations, all the stuff that guys that we just are so excited we don't have to go through. Those are things that when ladies go through testing and they get into our hormone replacement program, it's the most satisfying part of what I do. But the HRT is separate from the peptides. Hormone replacement therapies are replenishing what is missing in your body as it relates to testosterone, estrogen, progesterone. For the peptides, that's more of like, I kind of refer to it as like hormones being the gasoline and peptides being the nitrous oxide. You're normally not going to want to do a peptide unless you have your testosterone squared away, optimized. If not, kind of a waste. As it relates to like a BPC 157, that's different because that's specifically for an injury or some sort of inflammation. But generally speaking, the general rule of thumb would be hormones first, get those optimized, then put the peptides on top.
Yeah, I think like kind of the old adage, right, is like, you focus on those big rocks first, right? And I think kind of obviously for men getting the testosterone levels kind of normal. So one of the thing, again, you can elaborate as much as you'd like, or be as specific or as general as, you feel comfortable. So one of the things I know, like in the past, obviously the clinics like LifeMed and places like this are kind of popping up a lot more. In the past, I think it was a lot harder, or maybe it was a little bit more taboo even to kind of talk about testosterone, talk about some of these different compounds. And, I know the normal range is kind of a big range, and maybe you can kind of talk about that. And I think that could be kind of confusing because someone might feel good at a certain range. Other people might have symptoms. Other people might not have symptoms. So what does like kind of normal like range actually mean? And then when do we start to kind of look at like optimizing and then kind of going, past that? So what would be the difference? Obviously there's a point where TRT becomes performance enhancing, and that's kind of like the illegal kind of underground side of it. And then there's kind of the therapeutic side. So what are the kind of the differences, and what are we kind of like looking at there?
Yeah, they're awesome questions, Johnny. I appreciate that. So when we look at testosterone, we measure in what's called nanograms per deciliter. Not just, when I say we, not just us, anybody who's measuring. If you went to your PCP and you convinced them and twisted their arm and bribed them to have the panel pulled, they would be measuring what's called nanograms per deciliter. The range goes from 250 up to 1100. So low testosterone is a very subjective term. So here's the main issue with primary carers is, as a male, if we walk in there and our testosterone level's 350, we are in range. Right. So a PCP is going to look at that and say, you're in range. Well, yes, I'm in range. I understand that, but I'm in range for an 87-year-old man and I'm 35. So at that point, we'd be looking to optimize. Generally speaking, again, every patient's very different. Not everyone is a candidate for testosterone replacement therapies. Generally speaking, we're looking to replenish that to get it up in that 800 to 1,000-ish range. What we find is, once you get back up to those levels, you start to realize how good you feel. And for guys, I think what's different with guys, we don't recognize how bad we feel until we start feeling good. Meaning that testosterone drops so subtly, so gradually, day by day, month by month, year by year. It's such a subtle decrease that we normally just wake up one day, normally mid-30-ish. We wake up and we're like, well, this is weird. Like, I don't have as much energy. This belly wasn't here. I dropped some body fat. I dropped some muscle mass. I'm having some problems in the bedroom. I can't really concentrate. And it's like, wait a minute, maybe it's testosterone. So for guys, it comes on very gradually. Once we replenish that, and again, back to physiologic levels. Here's the funny thing about testosterone. If you have low testosterone, you have these adverse things happening. If you have too much testosterone, you have adverse things happening. So what a lot of guys find is they have low testosterone, we put them on hormone replacement therapies, they get their levels back up to 800, 900, 1,000, like, I want more. And then all of a sudden, if they start to go too high, they start to notice the reverse. Yep. So there's that sweet spot in there, but it's really about optimization and recognizing that what we're giving you is what's called bioidentical hormones, meaning that the molecular dynamic of what we're giving you matches almost molecule for molecule what you make on your own. One other thing I want to point out here, because this is critically important as well, and I deal a lot with this, John, the younger guys coming in, right? Testosterone replacement therapies are not going to be for the younger guys. Well, what's young? So again, a very subjective term, right? I'm 49. So for me, like 40 is young. So any guy who's coming in, I say 35-ish or below, if their testosterones are low enough and we really want to optimize them, we're probably not going to recommend testosterone replacement therapies for them, because it is a long-term thing. Once you start on testosterone exogenously, meaning you're taking it from the exterior, normally it's a weekly intramuscular injection, your body's natural processes basically slow down and stop because you're getting it from the outside. That causes a couple problems. Number one, if guys are still trying to have kids, it can hinder the ability to do that. Number two, the body's natural production of it slows down. So if you decide to come off of it down the road, there's no way to know where your levels go back to. There are other medications we prescribe. Your listeners have probably heard of Clomid or Clomiphene, HCG. These are medications for our male patients. If they're young enough, we would probably try to start them on that medication first to see if that increases testosterone. Because here's the tricky thing, I'll let you talk. Here's the tricky thing about testosterone. When I talk to a lot of guys, they come in, they're young, they've been told they need testosterone replacement therapies, they meet with our providers, they're young enough to where it's probably not going to benefit them. They probably should start Clomid first to try. And their thought is, well, no, I just want testosterone. I just want testosterone. And I think what they miss is whether you get the testosterone exogenously from the exterior with bioidentical, or if we give you Clomid to jumpstart your body's natural production, the end result's exactly the same. It's increased level of testosterone. It's like saying, if you and I both want to increase our heart rate, if I'm on the treadmill and you're on the elliptical, if both our heart rates go to 140 beats per minute, we both have gotten increased heart rates. So that's an important distinction to point out there, whether it be via one of those other medications or testosterone. But once you hit a certain age, 35, 40-ish and above, it's not Clomid, unfortunately. I'm 49. Clomid, I could eat 8 pounds of it a day. My body would be like, yeah, I'm done, dude. I've been going for 49 years. I'm good to go. Like, leave me alone. So that's a very, very long answer to your question, specifically about testosterone.
There's a couple of things I want to touch on, and I'm going to kind of backtrack to the first thing. So I think number one, I always like to make, training analogies, because that's like kind of how my brain thinks. So just like with training, there's like an optimal workload, there's an optimal training volume. And like I think oftentimes guys we think more is better. I'm going to do more weight. I'm going to do more sets. I'm going to do more reps. But at some point, there is such a thing as too many sets. There's a such thing as too many reps. There's a such thing as too much weight. So there is kind of like an optimal range for, we talk about, your minimum, adaptive volume, your maximum recoverable volume. And there's a window, there's a sweet spot where you can kind of make very steady gains without kind of hurting yourself. So trying to stay in that window, same kind of idea. You fly too close to the sun, you're probably going to kind of get hurt. But if you don't do it enough, you're probably not going to kind of make any sort of progress. Right. And then the other thing I think that's important too, I see this a lot of times in training, is people want to get to like the really fancy workouts, really fancy programs right away. But if you could just do like some push-ups, some body weight squats to get started, why not do like the least invasive thing? We could always put a bar on your back. We could always put more weight on your back, but why don't we just kind of focus on some basic stuff? So I think there's a lot of kind of crossover and analogies here. So I think number one, don't think more is better. And number two, there might be like a less invasive thing initially just to kind of get you going. You don't have to just go for the hormone therapy right away. So I think those are some really good points. And that's why kind of working with a professional to kind of see like what's going to be the best option for you, because everyone is different. And I think that, I always talk about, you want to be a sniper versus throwing grenades. So the blood work, working with a provider, you could be more kind of specific to the individual and not just be kind of guessing, oh, I'm just going to take a bunch of vitamin D, or I'm going to take whatever it is. If you actually know your vitamin D levels, because I know like that's something that's really common. We're very deficient, but like, how do you know like what your levels are if you don't actually get it checked? So I think those are all some great points that you kind of brought up for sure.
And the other part that I go back to, John, and I can't emphasize this enough, is the cardiovascular piece. I mean, again, you're talking about a disease that is the number one leading cause of death and is almost totally preventable. Number one, don't smoke. Number two, monitor blood pressure. Number three, manage lipids, being cholesterols. You do those three things, and you significantly decrease your odds of dying from the number one killer of all people. I'll ask you a trick. This is a trick question. This is for all your viewers, right? This, I think, kind of hits the nail on the head here. Patient presents with their first major cardiac event. So if someone is having their first major cardiac event, doesn't matter if it's a man or a woman, they're having their first major cardiac event. What is the number one symptom they complain of? Remember, it's a trick question. What do you think the answer is?
Oh man. Well, I'm thinking it's a trick question, but I'm going to say it's something to number one symptom. I would say something like to do with their breathing, or or they feel the pain in the chest. But
you ready for the answer?
Go for it.
Sudden death.
Sudden death. Okay.
40. Hence the trick question.
Yeah, that makes
49% of people who suffer their first major cardiac event die.
Yeah.
Why do I say this? I say this because you have about 90% control over decreasing those odds with modifiable, preventable lifestyle issues. How does it all come into play? It all comes into play because anyone who is hyper competitive, hyper in shape, hyper focused, a lot of times you kind of focus on the things and you leave a lot out there that's just not totally being looked at, and it can be dangerous in some kinds. So that's where, like I said, these, especially for guys, I just feel like we really muffle it. As far as the ladies are concerned, that's another topic. I love talking and working with the ladies as well. And the hormones for them, I think, has even a more critical role in improvement of the quality of life. That's a whole other topic, obviously.
Yeah, and if the listeners want to get like a more ladies specific episode, we could definitely get you back on. And I think because that's a whole other can of worms, I think. But I think the one point we'll just harp on is just know that hormone therapy is for women too, and these blood, so this is not just like a male thing. So, but we could definitely kind of save that topic for another day. The other thing I wanted to kind of maybe touch on, maybe you can, in terms of also like, especially the cardiac, we live a very stressful life. So in addition to kind of like looking at all these things, I know like one thing that I found a lot of benefit on is just even getting those IVs. Besides like the nutrients and stuff that you're getting, sometimes we have athletes that might be like cutting water and kind of trying to make a weight class. So hydration is really important. But the other thing I kind of talked about, the massage chair, it's kind of a very like common, just doing things to kind of de-stress the body, because we're always go, and we're always doing. So I don't know if you have anything to comment on that, but I noticed that like just taking that like hour or whatever to kind of get an IV, unplug from social media, stop working for a little bit, just kind of like shut off for a little bit. I always found that was just helpful. Just kind of like, I don't know if it was more of a mental thing, but just to kind of de-stress, take a moment, be a little bit more mindful, which sometimes could sound a little woo-woo to some of the guys, but I definitely take some time to like de-stress. I don't know if you have anything to kind of piggyback on that, but.
Yeah, 100%. So this is the other thing too, John. I mean, if you think about wellness, right? When you think about wellness, you think about the physical component, but really it's physical, emotional, spiritual, social, intellectual. There's all these components to wellness As it relates to these other parts of your life, there's lots of things you can control, can't control. You just have to be very cognizant of it. When you refer to like the IVs, for instance, these are great ways to rehydrate. You cannot get as much fluid drinking as you do with an IV bag. They're 500 milliliter bags of saline. They're 24 gauge baby pediatric butterfly needles. They're tiny. The vast majority of our patients, mainly the guys, they're normally the ones. The guys are always the ones who are like, I don't mess with the needle. It's a 24 gauge baby needle. You sit down for about 45 minutes to an hour. The saline, the rehydration piece, I think is the most magnificent part. But then we add all the water soluble B vitamins, vitamin C, calcium, magnesium, glutathione, zinc. It's an awesome way to just replenish what a lot of times people don't even know they're deficient in.
Excellent. So I do want to be mindful of your time, and I think definitely, if you're up for it, I'd love to do like a part 2 at some point, whether it's talking about ladies or if you guys want to hear some other topics. But I appreciate your time. Eric, if people were like kind of I know like you guys have locations also in Maryland, and I know like our kind of home base is Rehoboth Beach, but if people want to check out more about LifeMed or hear more about you, like where can they find you?
100%. One last thing I did want to put on too, John, just for your viewers as well. We didn't talk about this topic, but this has become extremely, extremely popular. The weight loss medications.
Oh, yes.
Everybody knows of it as, everybody knows it as Ozempic, which is technically not accurate. That's a type 2 diabetes drug, but it's semaglutide and tirzepatide, which are called coagonists. Whole other topic we could talk about, some weight loss stuff. Very effective. But yeah, as far as contact information, locations, our main location's in Timonium, so we're in Baltimore County, Maryland. Our second location is an IV suite inside of a place called The Mine, which is in Kenilworth Mall, again, Baltimore County. Third location was Rehoboth Beach, Delaware, which we just hit 1 year there. It's doing extremely well. Our fourth location's in Columbia, Howard County, Maryland, and our fifth location is currently under construction. We should be ready by about mid to late October, and that's in Bel Air, which is in Hartford County. It was formerly Bel Air Athletic Club, which is now Coppermine. Those are all of our locations. We have Quest in-house to have blood draws done on site. Again, our medical director is a cardiologist. We take appointments Monday through Saturday. Our website, LifeMedInstitute.com. You're more than welcome to put my cell phone out there too, if you like, John. I'm one of those weirdos who is on their phone 24 hours a day, 7 days a week, answering calls and text messages. So your viewers are all very welcome to reach out to me. And I can't thank you enough for having me out. It was an awesome conversation. I love the questions.
Yeah, I definitely give the LifeMed a follow. And, if you're in the area, like I said, I can kind of attest, I can only speak to the Rehoboth location. But, Mike and everyone there are fantastic. We've had a great relationship with them, always supporting kind of our powerlifting events and things like that. So we're just excited to kind of collaborate moving forward. And I know, like I said, personally, like I said, for me, especially this last kind of competition prep for me, I was in a bind to kind of help me kind of get through it. And, definitely from not just the health side, but the performance side. So definitely give them a follow. If you guys enjoyed the episode, please share it. Give us a 5-star review. It helps other people find us. Thank you so much for listening. Until next time, stay strong, and we'll see you soon.